Okay, so I'm getting ready to go for my second blood draw. My husband should be picking me up soon. And I don't know, I feel like I need to film honesty. Sure, I'll give that word out. I'm freaking out. And I know that that's probably typical, but it's because of a different reason. Like, it's not the pregnancy and being fearful over the pregnancy. It's the handling of care. And I don't know. So we're military and we're stationed in this really small base where they don't really have like medical doctors. They have doctors, but they're not OBGYNs. And so they refer you out, which is really rare for the military. I'm just really stressed. So you guys don't really know my birth history. I know I've kind of spewed a little bit of it in past videos, but not like a inconcise order thing. So essentially, when I turned 18, the month after, I was pregnant with my son, and I found out. And then he was born June 30th, 2007, and we had major birth complications with him. He was on tubes and everything, and he has one pupil bigger than the other because he had lack of oxygen for so long, which was really scary. The doctor treated me like crap because I was 18, and I had 11 people in my labor and delivery room that all hated her. Still do. So then we had an ectopic pregnancy in October of 2008, and then we had a pregnancy that had severe defects in June and July-ish of 2009 that we were told to terminate. And then we had a chemical pregnancy that October, and then we had, let's see, in 2010, I can't remember which month, I'm gonna say probably December, we became pregnant with my youngest son, Bryce, who was born August 11th of 2011. And then we had an ectopic pregnancy, and we actually had him here. So we moved from Washington State to Virginia when I was like huge. And I was on medications to stop labor from 33 to 37 weeks, and then my water broke, and he was born at 37 weeks exactly. Then I had a pregnancy that January, so he was born August, and then that following January I had a pregnancy that we thought was a miscarriage, but later found out was ectopic. My kids are fighting over graham crackers. Ignore it. And then, let's see, June and July-ish, so like at the late end of June, we had the ectopic pregnancy that burst my tube, and we were actually at a marriage retreat, and I had just slight spotting, but because we had the loss in January, it freaked me out. And so we decided to go to a hospital, and they took my blood work, and we had already had blood work, and the numbers hadn't doubled, and it was like a week, which is a sign of an ectopic pregnancy. So then that Monday I went in to see my doctor, and he confirmed that it was ectopic, even though I had already had an ultrasound that ruled out ectopic pregnancy. Yeah. So needless to say, my trust of care is kind of going down right now. I will not see that doctor again. He is the same doctor that I was pregnant with my daughter with, and who refused to keep me at the hospital when I was 4.5 centimeters at 38 weeks and 1 day. And then 30 hours she was stillborn because of a placental abruption. And the only cause that they could find for the placental abruption was the length of labor. And then in March of this year, we had a chemical again. And chemicals are when you have a positive pregnancy test before your period, essentially. And either you get your period on time and then no more positive pregnancy tests, or you get it a little late, but it's anything before 5 weeks. I think they kind of grant into that factor. But all my chemical pregnancies, I've always had my period like right after, on time. So back to this pregnancy. I'm 4 weeks, 6 days, so tomorrow I will have my very first pregnancy vlog up, hopefully, if today goes okay. I mean, I'll do it anyway, but it'll just be different if things aren't okay. So essentially, I had my blood draw on Thursday, and I was supposed to have a 24-hour referral, which meant Friday I was supposed to get a phone call from the nurse assigning me an appointment with the OBGYN of my choice, as long as they accept, you know, the insurance. And I had already picked out someone who is actually seeing one of my friends who actually lost her daughter 6 weeks after I lost mine. And she trusts him, so I trust him. And they essentially told me that he wouldn't see me until 8 and 9 weeks. Today is when they told me. Today is when they called me. It is Monday. Monday they call me to tell me the OBs won't take me, that I'm not considered high risk, because when they look on their computer, all they see is the ectopic pregnancy. They didn't even see my son's pregnancies, which is hilarious, which again takes me to the lack of care. But yeah, Friday, when they were supposed to call to assign me, you know, a referral, the lab technician called and said that my test was negative, which it wasn't. And then I had to go round and round with her, telling her she got the labs mixed up because I was staring at 2 positive home pregnancy tests that had gotten darker. And they don't just randomly do that. And she told me that I must have taken faulty tests, which I told her was crazy because I'm late for my period, which is really rare. And I have every pregnancy symptom I've ever had. Like, you can tell, I'm just sick. And she kept telling me that I was wrong. And then she told me that my proteins were too low, and I told her proteins aren't in pregnancy tests. And she said, well, your blood test came back negative. And I informed her that it was very, very tricky for them to get a blood test out of a urine sample. Yeah, because I peed in a cup. So she hung up, and like 30 minutes later called me back apologizing, saying that she was looking at the wrong test. So my level of trust is just through the roof right now, and it's just bad. And then today, so I went that night to get blood tests taken at the ER because I have been having stretching and pain in my left side, and all my ectopics have been on my left side. And they couldn't rule out an ectopic pregnancy. They did an ultrasound, couldn't see anything, and my HCG levels were 217, which is pretty early, which is right on track for what they should be, but it's still too early to say anything. And so they wanted me to have blood tests done today. So when the nurse finally called back, they weren't going to let me do blood tests. And then they wanted me to go see a group of physicians that I don't really trust at all. So then they told me that they couldn't get me in until Thursday, and that was at their office with their OBGYN, who's not really an OBGYN. So I don't trust that either. And then they confirmed with me that I was not high risk, which is a load of crap. Yeah, it's been a freaking struggle. It's so hard to get anyone to understand. Like, when you have a screen in front of you that says 2 things. And then the whole kicker is she started off the conversation by asking if we were trying to get pregnant. And then when I told her, well, we had actually just stopped trying because we decided to adopt, so this is kind of a nice surprise, she asked how we wanted to proceed with the pregnancy. Like, you don't ask that. I just don't understand. I mean, I guess I'm just kind of like in this crazy world where I expect people to be professional or something. But ironically, you're supposed to be, correct? Like, you go to school and you get a job, and you get a job because you're good at what you do, right? So you should perform well. So I get really frustrated that every time I try to do anything with this facility, it's constant battle. And it's ridiculous. So I had to tell her my entire history, which I know she wasn't taking notes on. She was just listening and kind of doing that, okay, And so after I told her, you know, I'm high risk for ectopic pregnancy and I'm high risk for placental abruption because that's how my daughter passed away and it has a high chance of reoccurring, she proceeded to tell me that she's an OBGYN nurse, so she knows this. And it's just, I can't deal with snarkiness at all. And I'm just really frustrated. Needless to say, I'm going in for a blood test right now. And hopefully they have doubled or tripled. I'm actually hoping they tripled because it has been 3 days since my last blood draw because today's Monday. And if not, I'm going to be kind of freaked out. But I'm sure I won't know anything until tomorrow. And then, yeah, oh, and then I have an OB appointment with the doctor I actually wanted on Thursday after I finally thought about it. It's really frustrating. I don't know, but hopefully things go better. Yeah, I'm feeling really sick. I will do a pregnancy vlog tomorrow and kind of give everyone the scoop on how I think we got pregnant, other than deciding just not to try anymore. And also what my symptoms have been, what our plans are, and all that jazz. Because, oh, we got some pretty cool stuff. We bought stuff earlier in the year for a rainbow baby because we knew we needed to have something tangible to hold on to that just stood for something important to us, and that's important to us. It's important to us to grow our family. So yeah, I guess. Okay, I'm gonna finish getting ready. But yeah, I'll see you guys tomorrow. And I'll let you guys know what my levels were too tomorrow.